morning, ma'am. I am Judith Ramos, and I will be your student nurse for today. And we will be doing the sterile, perineal care, and Perileite. So first of all, may I ask for your name and for your birthday? Okay, thank you po, ma'am. So today I will be explaining the procedures to you. So the postpartum perineal care is cleaning and caring for your perineum after having a baby, which is what you've done a while ago. And perineal care will help your perineum heal faster, feel better, and help prevent infection. Next is for the Perileite. The exposure, it is the application of dry heat to the perineal area to provide comfort. It increases blood circulation and hastens the wound healing. And the different importance of this is it provides comfort by relieving the pain. It relaxes muscles and capillaries, making pain tolerable. Hastens wound healing following an episiotomy, increases circulation of blood, increases supply of oxygen and nutrients, which promote wound healing, reduces dry heat, thus help reduce edema and soreness. And this procedure is indicated for patients who have undergone rectal or perineal surgery, postpartum, patients with episiotomy, and patients having vaginal inflammation or bladder spasm. Next, I have also provided privacy with screens and drapes in order for the patient to feel comfortable and for confidentiality. And next, I will be giving an extra pillow to raise the head of the patient. And I will be offering a bedpan. Okay. To clean the perineum, or it can also be used if the patient has a need of passing urine or stool. And next is I will also be observing the Rida. So I will first be exposing your perineum, ma'am, and I will be observing the Rida po. And if you have any discomfort, please tell me for your privacy. So I have observed that there is redness due to the delivery, and it is a bit edematous, and there is some local discharges as well. And next, I will also be arranging the materials conveniently on the bedside, so which is the draw sheet or underpad to protect the bed, betadine solution to clean the perineum, as well as the cotton balls, the sterile thumb forceps to hold the swabs for cleaning, the kidney basin or dipper to receive the waste, clean linen to make the bedding clean, and then we have the pads and dressing to keep the patient clean, and we also have the bedpan to clean the perineum, and as it holds as a passing for urine or stool, and we also have a small towel to dry the perineum, and the drape sheet and screen to maintain the privacy of the patient. Off, we will be starting with the perineal care by washing our hands and performing proper hand hygiene. So, show me that I have performed proper hand hygiene to prevent cross infection. I will then be taking my draw sheet and I will be spreading it to prevent bed soiling. Next, I will I will keep the patient to maintain dorsal recumbent position for the proper assessment of the perineum, and then I will be wearing my sterile gloves, and this helps to also prevent cross contamination. So now that I have worn my sterile gloves, I will now be adjusting the bed pan under the patient's buttocks by also supporting the patient's hip to prevent to clean the perineum. While maintaining a dorsal recumbent position. And so, ma'am, I will also be exposing the perineal area. If you next, I will be pouring water over the genital area to wash off the discharge of the perineal area. And next, I will be cleaning the genital area using the sterile cotton balls soaked with betadine solution. And this is to prevent the entrance of bacterial from the colon into the urinary tract. I'll be holding the cotton balls with forceps and clean the area to prevent contamination and use one cotton ball for one swabbing. So in cleaning the genital area with the following order, which is for one cotton ball, the labia majora, minora, the clitoris, to the vaginal orifice, and to the anal orifice. And I will be discharging all of the used swab cotton balls in the dipper. And I will also be cleaning the perineal region and anus thoroughly and gently so that the patient does not feel any discomfort. Then I will be removing the bedpan by supporting the hip such as before by the patient on one side. And we'll be drying the buttocks with a small towel. For our infrared or peri light procedure, I will be first spreading the draw sheet to prevent the bed from swirling. And next, I will be maintaining the position of the patient, which is the dorsal recumbent position for the upper access of the perineum. And next, I will be wearing my gloves. And this helps to prevent cross-contamination and the risk for infection. Next is I will be applying betadine solution on the episiotomy side. So, ma'am, I will be exposing perineal and I will be applying betadine. And this is to sterilize the perineal area. Okay, And after applying betadine solution, I will be exposing the perineal area for 15 minutes if it's 220 volts or 30 minutes for 110 volts to infrared light. And this provides comfort and fastens the healing process of the episiotomy. And I will take note that I will be placing the infrared light 18 inches to 24 inches away from the perineal area. For this helps in preventing perineal burn. So assuming that this is 18 to 24 inches away from the perineal area, so since we do not have a screen, let us pretend to and we will be leaving this, assuming that the Peri light that I am using will be 220 volts, and this will be left for 15 minutes. Assuming that 15 minutes have already passed, I will be removing the Peri light and the screen. So, also be turning it off. Ayan. And the screen. Ayan. And I will be recording the procedure with the date, which is February 28th, and the time, which is 11:35 p.m. and the observations made during this procedure. So the aftercare of all of these procedures is that I will be changing the linen if necessary. So, and I have already removed the screen and tidied up the unit, and I will be washing my hands, and I will also be recording the procedures with the date, time, and observations made. So, thank you po, ma'am.